All right, so we just watched Larry go through some movements, the squat specifically on a box. And we noticed that the 20-inch box was just a little bit too high for him. So we added a couple inches with the blue X pad, just so we could control down, touch, and come back up with his squat. We looked at it from the side and the front. So as a therapist, Larry's similar to a lot of the patients I see. Well, probably the main reason that I started developing or thinking about the SquatGuide is that I can help somebody in the clinic with my hands and get them in a good position. And then when they go home or if they're practicing on their own and doing a warm up before I get to see them that day in clinic, they might forget some of those cues. They might revert back to kind of a poor strategy, or maybe they have some type of condition that really limits them. And without something there really guiding them and giving them a visual, it's hard for them to get their knees and hips and back in good position. So now what we want to do is kind of see if there's a difference in how low Larry can get, and just how well he moves inside the SquatGuide doing the same motions that he just did outside of it. So what we're going to do is first just have him sit down on the pad facing the camera here. We're going to try to set this SquatGuide to fit him. So again, we want these knee guys to be about knee height. They don't have to be right on. We're going to raise this up. I'm going to take this up to the tension. It's about there. We'll do the same thing on this side. A little bit low. Here. And then, Larry, from a stance, from a width, does that feel okay?
Yeah, that's about
where you have it?
hip width, maybe just
Okay.
hair wide for what I've been doing, but
Okay.
pretty close.
Pretty close, okay. Now I'm going to push this all the way back, so when he stands up and sits back, we don't want his feet too far forward because we want him to feel like he's going to go back and touch the seat he's coming up from. So the SquatGuide, the two rules is that, I guess there's a couple of rules in that, but we want your toes to touch the front rail, and we want your toes to also touch the outside rail. So you can kind of be out in the corners of that foot plate. And then how much you have your feet turned out is kind of up to the user. So whatever is comfortable for you from a foot turnout position, that's up to you because it's all going to equal out as we use the SquatGuide anyway. Okay. But the rule is, you want your toe to touch the front and the side, and then how much turnout is up to the user. So as we move, we want to kind of keep our knees at least over our feet, right, as we squat. So that's what this lateral knee guide comes in. So this outside knee guide, if his knee stays in contact here, I know his knee is at least over the foot. And it's not diving in and causing a lot of stress to the inside of the knee. The other thing is we try to avoid contact with this front guide. So the knees can come forward somewhat, but we don't want it to go too far forward. Okay, so if he starts going too far forward, this front knee guide is going to block him and make him use his hips some. And so a lot of people who have strength deficits or just haven't moved well in a long time, they tend to really squat with a knee strategy and keep their spine erect. Or people who've had back surgery, they're tentative to load their back, so as their torso comes forward, that puts more pressure on the low back muscles. Sometimes people get apprehensive about that if they've had surgery, and they need to develop those muscles because as our hips go back, our chest should come forward a little bit as long as we keep good spine position. And so this will make us get back in our hips as we squat. So again, from the knee standpoint, we want to at least maintain contact with the outside rail. We want to avoid contact here. If you hit it, it's not a big deal because it's going to send you back from there anyway. So on each side, that's what we're going to ask you to do. For most of my patients, I have them put their hands out in front to create a little counterbalance, but that also gets the spine muscles to be nice and active and give you a good, secure spine position. Whereas if they're kind of hanging down, it can kind of pull you down into a rounded back position. So he did a couple of reps like that anyway. Do that front squat position too, whatever you want to do to get a little counterweight going. And again, that'll keep the low back and upper back in a good position. So we're just going to watch Larry here, and I'm going to give him a few pointers as he goes out or he does a few repetitions. But again, try to avoid contact in the front, try to sustain contact here. If as you go lower, you want to push out more, then if you want to push out a little bit, that gives you more control and grip. But you want to at least maintain contact. Okay? So we'll just have Larry do a few reps from the front here.
Stand up.
Let's pause right there.